24 Berea Knowles Drive. I have a student at Riverbend High School. Mr. Chairman, Madam Vice Chairwoman, and members of the board. Some people think it's safe to jump out of an airplane. Others think it's dangerous to get out of bed in the morning. It's all about your risk tolerance. Of course, the safest plan to return to in-person instruction would be 0 cases. That's not likely anytime soon. The Virginia Department of Health's contractor, RAND Corporation, has advised VDH that a 5% test positivity rate is a suggested target for a successful test and trace strategy. The World Health Organization recommends a 5% or lower rate for 14 days before a region reopens. The Harvard Global Health Institute recommends no more than a 3% rate. New York State, one of the most successful states in curbing the spread of the virus, announced that schools can reopen for in-person instruction as long as the positivity rate is below 5% using a 14-day average. Many epidemiologists I've spoken to have suggested below a 2 or 3% rate would be preferred. As of today, Spotsy's 14-day test percent positive average is nearly 10%, and its 7-day average is nearly 12%. This is too high to safely reopen for in-person instruction. Why is a low test positivity rate important? It's important because it reflects a high surveillance capacity and rapid case identification. It means we have enough testing volume to catch anyone who has been infected by the virus, including asymptomatic persons. In order to acquire stable prevalence, it requires a testing strategy that moves beyond close contacts. We are only testing 150 people on average a day in Spotsylvania. Out of Spotsylvania's nearly 136,000 population, this simply is not enough to safely reopen and establish epidemic control. Case incidence per 100,000 is a valuable measure when you have adequate testing volume. However, it tells us nothing about prevalence of the disease in our community, since it is not tied to testing. Right now, only the sickest people are getting tested. The CDC notes that 40% of cases are asymptomatic. We need much higher testing volume to rely on this measure. It's helpful to project potential hospitalizations and future IC bed needs, though. As of today, Spotsylvania's 14-day case incident per 100,000 average is 11.12. This is considered high risk even with adequate testing, or without adequate testing. Worse yet, Spotsy's infection growth rate is 1.03. Anything above 1 means the virus is spreading quickly. We only get one shot at reopening our schools and need to get it right, or it will be difficult to open again. Now is clearly not the time. Those banging the drums to open schools, whether they are prepared or not, are essentially rolling the dice on a possible coronavirus blitzkrieg. A hybrid environment is not a magic pill, and corona is not a magic virus, and is not going to go away if we ignore it. A hybrid environment makes no sense from an infection prevention standpoint. Think of all the social contacts on remote days. As a parent of a Spotsylvania public school student, I want him to return to in-person instruction. However, the health data must support it, and schools must aggressively implement proven risk reduction strategies. A layered approach should include rapid testing and contact tracing, physical distancing, mask wearing, frequent hand hygiene, and well-ventilated spaces. A critical step to reopening schools is to keep community rates of COVID-19 low. We need more testing. Reopening our schools for in-person instruction shouldn't be an us versus them argument. It's not a Democratic or Republican argument. It's about our children and the scientific evidence. I must also push back against this false binary narrative about COVID-19, that you either recover and live or you die. Studies have shown that previously healthy children and adults with mild symptoms or those who are asymptomatic have experienced heart damage, brain damage, chronic lung disease, unexplained long-lasting fatigue, migraines, dizziness, and chest pain. A return to in-person instruction can wait until the health data supports it and we have the resources and plans to do it right. If you're out there thinking, let's just put all the children back in school because that is where they belong, you may... I'll be like a second more. I'm just finishing up here. Is that fine? If you're out there thinking, let's put all the children back in school because that is where they belong, you may want to rethink that. Of course we all want to go back to school. I want Coca-Cola to come out of the water faucets, but it's not going to happen. Listen, people, it's time to eat your vegetables, wear your mask, wash your hands, and stay home learning virtually to be safe. You'll get to have your ice cream and cake and go back to school. But let's do it when we know it's safer.
Thank you, sir.